testosterone and some steroids. Is it safe and sustainable? This is going to be a very important video along the harm reduction means. And this is a video only for men that are on testosterone. You young guys that are not on testosterone or any steroids yet, this is definitely a warning saying don't do this. This is something for men that are on testosterone and they're looking to get something more. Because as a physician, internal medicine doctor, the anabolic doc, testosteronologist, taking care of thousands of men now for 20 years, it's amazing that mainly young men, up until their 40s actually, they're on testosterone and they want to add some steroids a little bit. Okay, now this is not for the mass monster, because the mass monster is a whole different deal. They're young, they're taking a lot of steroids to get massive, either to be a pro or, as we know, just to be a regular guy, not a pro, just for that high and to feel great. But this is something that's not sustainable, really. And of course, when you're very young guys, you have so much health reserve that you're just chewing into the health reserve, but it's like the straw on the camel's back. You're dropping the straws. Camel's not affected at all in the beginning. But what point does it hurt? Mainly your heart and your kidney system, not to mention the prostate, mental health. You know, the hair, the acne, the gyno, it's not that it's not serious, but that's not going to kill you. But I'm always about deadly things. So this video series right here, testosterone and some steroids, I've seen men, even for up to 20, 30 years, that have done some of this stuff, and I'm giving the information to you. This is real information from thousands and thousands of men that I've taken care of, and I've made some notes. I really did a lot of research for this, and I've kind of combined a lot of things in one video. So this is going to be a really cool video because it's going to give actionable information, actionable, which means this is real, and then here's what you are going to have to do. And again, it's always harm reduction we're going to move through right here. So let's get into the video, guys, because I have direct information, scientific information that I've noticed with my data. Again, thousands of men on androgens, 20 years now, from the top pros, bodybuilders, powerlifters, strong men. Now, those are minimal because those guys themselves are just not big numbers because there's so few of them. Genetics and the whole nine yard. But this is more the average guy. It's you, the average guy. You're on testosterone, you're adding, what are those add-on steroids? Are they sustainable and safe? The guys who have been sustainable and safe beyond the grace of God and just good luck, here's what I've seen. Now, let's get into it, guys. Here's the science. This is more for the bro science guys right here. Number one class of drugs that I've noticed is DHT-derived steroids added on. Again, this is added on to testosterone. Primo, Masteron, Proviron, Anavar. Wow. These are the ones that guys have used, you know, cycling on and off, adding training days to a few weeks to maybe a little bit more, on and off, you know, taking consideration all the ABCDs and just really mortality, death. In the end, they're still alive. Now, these are guys now into their 40s, 50s, and even 60s. Even some guys, I've seen some guys in their 70s. You know, they've been on this stuff since the 1970s, okay? So this is really, really interesting information. I want to be one of these guys. That's why I made the anabolicdocapp.com for you guys to get a facility, a place, a digital online clinic where you could understand everything. And now you could come and you could understand what exactly to do for yourself with your caregivers. That's what it's going to be, guys. So let's get into it. So something about DHT-derived drugs, a little Primo, Masteron, Proviron, interesting, right? That anti-estrogenic potential, even a potential for HRT drug itself, and of course, Anavar. But we're going to get into these as they're going to come out as I keep discussing kind of some of the side effects. These are the players. Number one position, the safest, most sustainable add-on are these. I'm not going to get into the doses, guys. Let's get comments. Give us your doses. Let's talk about that. Come on the app. We can talk about that in the meeting, the open group meetings that are, of course, uncensored. Number 2 position is the NOR19 DECA, Durable and NPP. And let me explain. So, but this is the number 2 position because mainly down here, the side effect profiles. Okay, it's all side effects. Now, let's keep going. So when you look at what I'm going to say, what is not sustainable and safe, I don't think tren is, but I know you guys, I know some of you guys will add little baby doses of tren on and off, and you think it, and you'll say it's okay. But again, are you young? Are you lucky? And are you in that health reserve where you just have the camel's back scenario where you have health, you're young and healthy. It takes a lot to bring a good man down. But is it going to affect you again in your 40s, 50s, 60s, and on? That's is all I care about and my only focus. Make it sustainable and safe to have a great quality of life, man. Who doesn't want to have it? Great sex, no bypass surgery, no cardiac issues, no cancer if you can, my Lord. This is beyond all that. This is just screening. You have to understand primary care. That's why I made the app for you guys. So I don't think tren's sustainable, even at different low doses. Plus, it makes the sex crazy, and there's that edge, that double-edged sword of the tren dick. It's a good dick, it's a bad dick, it's a tale of two city dicks. So, Dianabol, right? It's D-ball. Dianabol, heavy-duty drug, oral steroid, testosterone-derived, equipoise, testosterone-derived, Anadrol, DHT-derived, I know. Winstrol, DHT-derived, I understand it for all you bro science guys. It's just that these DHT drugs are on the top level because they're just much more sustainable. Why really is it? I don't know. No one really knows. The potential that they're not very estrogenic and therefore the side effect profiles are better. It's all going to be side effect profiles. So let's keep going, guys. But the main tenet of this video for you gentlemen all over the world, you're on testosterone, you want to keep testosterone itself the lowest possible, not to mention these add-ons. So that's where I see the sustainability. If guys coming in, they're like, doc, I'm cruising on 200, or they're on an anti-aging place, oh my Lord, and they're on 200 or more, they're full of fluid, they're bloated, their blood pressure, the heart, no one's even done anything. Everyone's just dumping blood all over the sinks and just giving blood everywhere they can, and they're just, this is just craziness. So the main thing, common things are common, guys. Common sense is really number one. Keep the test as low as possible. If you're adding on Proviron to battle the estrogen of too much testosterone or even AIs, it doesn't make sense, guys. It just doesn't make, this is a secret. Keeping testosterone as low as possible. For an example, most of my patients, they're going to be on testosterone cypionate. Here we are in North America, dosed at 200 milligrams per mil. They're on 0.5, typically 0.35 to 0.5, maybe twice a week, maybe every 5 to 6 days. Some guys just take it every 7 days because they can't take the, some men sooner or later, they're not newbies anymore. They're like, doc, can't I just inject every Sunday morning? I can't remember this every 5 day, twice a week, not to mention breaking it up every 3.5 days. I do one time, I'll do in the morning. The next time I do at night. It's LOL stuff, guys. After years and years and years, when you're busy, it's going to be, some of you guys can do it. It's every man's got a fingerprint. I take care of every single type of man with a different personality in the world. They're all good guys though, because I only have kept only good guys in my medical practice because I closed off the top. No more new patients, guys. It's not easy to do. And it's just a full house of great dudes. It took about 18 years, and we're busy with you guys. Everything else is going for the app, anabolic.app.com, and right here. And I'm just always cranking for you guys, and definitely doing some research. You'll see about that later. And I love to be in movies like Hulu. You see that. So lowest dose possible. Now, same thing carries over with the base androgen, which is testosterone. This is your base androgen. Everyone knows it. You're on it, T or T. So you're already shut down, or you made a decision to go on because of steroids, or because of anabolic steroid-induced hypogonadism, or you just went on T because you were low, or you were low enough and you wanted to do it and you feel great and you want to add something on board. This is presentation for you. Alternate these other anabolic energetic steroids, alternate them, take breaks, low doses, monitor your ABCDs. Guys, this is the money. This is the guys that are sustainable, my patients that have been able to get away with this in addition to luck, and they're young. Again, there's that health, residual health, where they're just in reserve and they're just chipping away. Steroid users, when you see the pros, they're chipping away at their health. It's quiet and it's completely unseen. And looking at their labs and stuff and calcium scores, which is important, of course, but if you're in your 20s, I'm not saying it's useless, but of course it's going to look bad when you're on, then you come off and it cleans up. But what's cumulatively happening to your organ? You're damaging the organs, but there's no way to measure it. It's just cumulative damage. You gotta believe me, guy. That's why I want you to take some actions right here. Okay, why do men do testosterone plus some safe steroids potentially? Because they want a little more muscle size ripped up and they want some strength. The sex, wow. Men love to add primomasteron and proviron to affect the base testosterone, to increase the free. It affects obviously sexually binding globulin, and then you get this increased stimulation on the limbic brain, and they're horny and the sex drive. It's true, guys. I've experienced it myself. But if you stay on this stuff too long, the body's always trying to maintain homeostasis. There's something called downregulation. This is not going to get into all the heavy-duty bro science guys trying to show off because it's stupid. There's so much science going on here. It's so multifactorial. It's so man-per-man fingerprint related. This guy did this. He feels great. This guy did that. He doesn't. What? Come on, guys. You need to understand the science here and the individual basis of this. And then as you're getting older, you're just chipping away at your health reserve, chipping away at the block of your health reserve. You need to provide aggressive protection. I'm here for that for you guys. So sex, how many guys I've seen on testosterone have added Anavar, not to mention Primo-Mast, and their sex drive, and they're horny and they love it. And then, doc, they call up, it went away. I lost it after a few weeks, after months. And what do? I have to stop these add-ons. You got to keep the base because they're already on testosterone. And then you hit a reset button. And then some of the bro science guys go into all this recycling of receptors with like antihistamines and all. This is so complex. It's more for the muscles and stuff, and cycling steroids and stacking steroids. This stuff's been around for decades. But with the sex, it's amazing. Okay, so and that's why keeping the stuff very dynamic, the body's going to respond to that. And everyone is unique. Some guys could stay on a lot of testosterone and even some of these medications up here, and their sex drive's always great. Other guys just don't really they have sexual issues with libido and erectile dysfunction. We have to get into that down here with the ABCDs. That's physiologic right here. But they just have it because they just have these issues. And a lot of it's mood disorder and personality and anxiety. Come on, guys, general anxiety disorder. You have to understand that's the mood and the aggression. Of course, it's an asshole on steroids. This is like, is it negating that? Is it treating that? This guy was great. His anxiety and he was anxious and he was depressed until he started doing this. And then, or other guys were feeling great. Now they're on this combination and they're not getting it from a good supply anymore. And now they're irritated and anxious. Guys, whoa. There's so much, but this is why you guys do it. You do it for muscle and strength. Why you add some steroids. Sex, DHT drives steroids, LOL, right? And mood and aggression. The mood, confidence. I just sold more cars. I made more deals. I want to hang out with my kids. I want to play with my kids. I want to hang out with my wife and my friends. I'm more outward. I just feel great and confident. Oh my Lord, guys. That's why guys are going on testosterone. But again, it's going to be dynamic. All right, let's talk about this. Let's close with what you can do to make this as safe and sustainable as possible. Not to mention, This is just primary care information. That's why I'm looking at you guys and saying, I got to take care of all these men. Anabolic.app.com. It's your home for primary care information, because that's what I am. And I just focus on men, on androgens, blood pressure. We're not going into the A, that's hemoglobin A1C. We're not going into glycemic index and diabetes and prediabetes. It's not relevant here. Blood pressure. When you add decadurabolin, no question, guys, I know it's not estrogenic, progestonic, and the prolactin. Guys, don't get into this rabbit hole. Men that are on Test and Deca, I've seen it, I've done it, I've been involved with thousands of men, blood pressure goes up. Dose related, dose dependent. What's the dose of the test? What's your genetics? Why are you hypertensive? Is it just your baseline? Are you older? Come on, guys. So these other drugs have a less affinity for causing the blood pressure, but Anavar can. And if you're on a teeny dose and it doesn't do anything for the positive stuff, the muscle and the sex and the mood, and mainly the muscle. Guys, you're trying to get a little bit more muscle, but you're trying to play it safe. I get it. But will that increase vasoconstriction, mean arterial pressure, and can adding Anavar increase blood pressure? Yes! The other ones can too. Come on, guys. So blood pressure, I want you to monitor your blood pressure and come on the Anabolic Doc app and let me help you get this down. You want to be aggressive, closely monitoring and protective. You need some medicines, guys. I use them. I've been using them for decades. I work with my patients on them. I'm not selling meds. The future, the wealthiest men in the world are doing this right now. Wealthiest guys in the world, okay? No names mentioned because I take care of some of them. Super successful men. Supplements can help to some degree. If someone's selling you supplements for this ABCD, the blood pressure, the cholesterol, they're full of shit because it can work. And I'm going to make a great supplement. It's a supplement. But the real money is the real chemical science, guys. You have to believe me, but you have to understand how to use it with a doctor like me. So ACE, ARB. Now, beta blockers for blood pressure, that's cringy. We don't do that anymore. I have metoprolol and atenolol. Metoprolol, atenolol, not used. There's cardavolol, which is a little bit better. And there's a drug, it's a cardioselective nitric oxide doning beta blocker called nebivolol. It's absolutely phenomenal, synergistically with ACE or ARB. I like the ARB combination. Depending on who you are, if you're an African-American gentleman, calcium channel blocker, little thiazide diuretic. Guys, synergy. Synergy is the key. If a doctor just says, or your nurse practitioner, start with metoprolol and ramp it up, that's cringy. If you have essential hypertension, just nicely walk out and get on the app and we're going to redirect you. It's just cringy, okay? You research this stuff, you're going to say, wow, O'Connor is right. Dr. O'Connor is right. How come my doctor doesn't know? They're overloaded in the clinics. They can't keep on top of the academic stuff, but this has been so long. If you're using a beta blocker for essential hypertension, that's just straight up wrong. We don't use beta blockers as first line for essential hypertension. You fact check that, sir. Any country, any part of this world. These are the medications, but it's based on your history. Some ethnicity plays a role too. It's based on so many variables. And then we have to get the blood pressure down. You see my blood pressure on Instagram? Every day it's under 120 and under 80, but I'm on two medications. I'm on the ARB and the cardioselective nitric oxide doning beta blocker. This is a brilliant, just what I do. It's what I do. Let me help you on the app. So again, synergy. Don't just take a medicine and ramp it to the top. That's wrong now. We take, depending on who you are, you start low and you go and monitor slow, but you can add two medicines if you have substantial hypertension. You could add a two-class medicine and get a phenomenal effect with less side effects. Let's go to C. That's cardiac, cholesterol, coronary artery calcium score, echocardiogram. More synergy. Guys, again, you're on this medicine combination. You're feeling great. You need the ABCDs. B is blood pressure, done. Cholesterol. If you're somewhere around your 30s and you have any risk factors for heart disease, blood pressure is not perfect, cholesterol is not perfect, family history, get a coronary artery calcium score, come on the app, let me help you understand this stuff. Echocardiography, if you're hypertensive, you're on steroids, even a little bit of steroids, for men, depending on your predilection and who you are, you're going to have left ventricular hypertrophy. Your heart is in low. I'm telling you, this is potential. Your ejection fraction can be low. And there's also heart failure with preserved ejection fraction. Guys, I study this stuff. And there's some medications for this stuff now. Now, synergistic combination. I'm going to give you some secrets right here, but I can't go into full blown here. It's just too complicated. And YouTube doesn't like it when I go into all the trade names, so I'm trying to tread cautiously here. Statin combinations, PCSK9, sodium glucose cotransporter 2 inhibitors. This is new stuff. If you have some damage to your myocardial tissue, you have a lower ejection fraction or even preserved ejection fraction, going into heart failure, not to mention kidney disease. Guys, this is where it is now. I'm using this stuff. It's credible. Vascepa and, of course, phosphodiesterase inhibitors, which are sex drugs and rock and roll, right? These are the Tadalfa. This is the Stender, the Levitra, the Viagra, the Cialis. So a bunch of these are super cheap and generic now in North America with your doctor. You can get these. And they have cardiovascular protection. Nitric oxide, up in that, it's the cardioselective nitric oxide doning beta. Guys, I'm going to town for you, but this is where I'm 20 years ahead. The data's here today, but it's 20 years ahead to put it together for the common man, and I'm doing it right here for you right now. Those are the meds. Come on to the meetings in the app, anabolic.app.com. Let me help you with this. I want to help as many men as possible. D, this is complicated. Deposition disease, mainly you add test and DECA, you have a potential for going up for the red blood cells and the iron deposition, which is called androgen-induced erythrocytosis. This is complicated stuff. You have to monitor the CBC and also the iron levels with the iron studies, transferrin saturation, and ferritin. Guys, come on the app. I've provided you guys on the Anabolic Doc app with labs in America with no doctor's prescription. It's super dirt cheap as well. Wholesale numbers right there. Wholesale deal for you guys. So you could monitor all this stuff, cholesterol, your blood pressure yourself, and then the CBC. And everyone, so many guys are dumping blood at anti-aging places, but they're not doing it properly by understanding the iron side of it. I'm telling you guys, it's deadly shit. When you look at this stuff, that sustainability and safety, it's going to come down to these right here. After D, so again, B, C, and D, guys, I'm begging you to focus on this. Every country in the world, I'm here for you with the Anabolic Doc app. That's why we made this thing. I want to help millions of guys. S stands for PSA, which is prostate. So the DHT-derived drug, we know that these drugs are already DHT-derived. It's very controversial they can't convert 5-alpha reductase to be a DHT-derived drug. They come that way, so they can't be further converted. Like testosterone goes to DHT. Guys, the hair is not going to kill you if you lose it. The prostate, though, again, thank God steroids, testosterone mainly, we know, doesn't cause prostate cancer. Oh, my Lord, thank you so much, God, for letting us use this and be humble. But if you have prostate cancer or your prostate's enlarged and you're giving DHT-derived drugs, there goes the hair and there goes the prostate potentially. No one knows about this. I don't even know. I'm pondering this. I'm finding the best urology center of excellence doctors to talk about this, but they're busy in the operating room, these guys. And I'm not going to work with this kind of stuff right here with yahoos that are not excellent, legitimate, board certified academic experts, surgical expert prostate. No way. Those are the only guys I will ever talk about this with. I'm not going to hear it from some clown. That's why I'm here for you guys. I'm a lone wolf, guys, for you guys. So this prostate is you have to check your prostate. If your PSA goes up and you rode a bike or you had sex or it's up or down, I don't want you to freak out that you have prostate cancer. How old are you? Do you have a family history? What's going on with this stuff cumulatively? So go to a great urologist And before they biopsy it, potentially, make sure you get a prostate MRI. Look at my video on the prostate and testosterone, the 12 rules to live by on testosterone about the prostate. I deal with this every day. I help my patients broker deals because I refer them to the best urologists, centers of excellence, John Hopkins, University of Miami down here in Florida, up in the Northeast at Harvard, New York City, Columbia, Mayo Clinic in Cleveland. Guys, I see this every day. I work on this with men that have blown up prostates that need relief because they have BPH, on top of men that have Gleason 6s and they have prostate cancer, even in their late 40s and 50s. It's just bad luck. And then you're on androgens. Guys, I'm begging you to understand the heart and the prostate and the kidney. That's really all that's going to matter for safe and sustainable. All right, last one here. So I did it. Blood pressure, heart, kidney. That's all the heart and kidney on top of understanding all the stuff above. I think these could be sustainable, low dose, easy, monitor all the stuff here, prostate as well. And serotonin. So the S, you see A, B, C, D's, S, serotonin, that's depression and anxiety. I think I already talked about that already. That if you have a baseline of depression, mood disorder, plus or minus general anxiety, guys, I take care of you guys. I'm your doctor. Most men have some of this. I have it. I have to be on a little Zoloft. I like the Zoloft though. I just love it. Keeps a cap on me. I'm still focused. It's great for sex. If a guy has a little premature ejaculation, you're like a porn star. You have to use these chemistries, guys. You just have to understand how to use them. There's no two you guys. No two of you guys are alike. Everyone's got a fingerprint. I really hope you guys like this. I really busted this one out for you guys. More of the great bro science coming into real science together, as I'm the Anabolic Doc and I'm here for you guys. I will see you on the Anabolic Doc app and I'll see you in the meetings. Thank you so much, guys.